How to protect an infant born to a diabetic mother. Abstract. There are several risks prevalent in an infant born to a diabetic mother. These include respiratory problems, heart problems, congenital malformations, and iron problems, among others. Care must be taken before and after the infant is born. This paper evaluates an effective care plan to be given to the baby as a way of mitigating the risks of an infant born of a diabetic mother contracting the disease. In this paper, proper nursing diagnosis and interventions are critical to protecting an infant born of a mother with high glucose intolerance. An infant with a diabetic mother, care plan. An infant with a diabetic mother is defined as a newborn baby whose mother suffers from a diabetic problem. A study shows that infants born to diabetic mothers are often bigger than normal babies. There are real risks prevalent in such situations. Perry et al. Argue that these risks are experienced mostly during the pregnancy period. This discussion looks at the care to be given to infants with diabetic mothers. Nursing diagnosis. Several diagnoses are prescribed to infants whose mothers are diabetic. First, it is important to have the glucose levels of the newborn checked. NANDA International writes that it is very important to monitor the levels of glucose in the blood of the baby after birth. Controlling the glucose levels of a baby born to a diabetic mother may involve mixing glucose with water. This method ought to be introduced to the baby at a very early stage of life of the baby. The blood of the baby is drawn using a heel stick or using an umbilical catheter. A doctor can also use a needle to draw blood from the arm of the baby. The second nursing diagnosis is checking the levels of calcium in the baby. NANDA International explains this as an analysis of hypocalcemia, meaning low levels of calcium in the body of the baby. Babies born to mothers suffering from diabetes are likely to suffer from several congenital complications. This has to be treated at the earliest time possible after the birth of the child. Prompt management of this problem significantly decreases the risk of the child suffering from multiple health conditions. Thirdly, a nurse managing the post-delivery of a mother suffering from diabetes also ought to administer phototherapy to the child if there are signs of significant jaundice. This is always during a short period, mostly about 2 to 5 days. This means to break down or manage the bilirubin present on the skin of the baby. Nursing interventions. Firstly, it is important for the nurses managing an infant born of a diabetic mother to observe pediatric nutrition. NANDA International writes about this intervention and explains that it is concerned with the general well-being of children born to diabetic mothers. A nurse has to administer this intervention as a way of preventing possible health problems emanating from the diabetic problems of the mother. Secondly, the nurse in charge has to manage the metabolic of maternal diabetes in the mother during pregnancy. This is aimed at improving the outcome of the baby, or the perinatal results. This metabolic control has to include timing the delivery of the baby for quick action on any problematic outcome due to diabetes. This intervention would greatly reduce diabetic risks for the baby to be born. Thirdly, the newborn baby has to be highly evaluated. This has to be based on the APGAR score, which would give indications of the need or lack of resuscitative plans. This is the first test that is given to any newborn to determine health conditions. The timing of the APGAR test is highly important for the nurse and the mother of the newborn. This is critical as it helps in planning any immediate actions that have to be undertaken to save the life of the baby if needed. Outcomes of lab or radiology on infants. There are several outcomes realized when laboratory or radiology actions are imposed on infants born of mothers suffering from diabetic problems. First, there could be accidental damage when there are injections or surgeries done on the skin of the baby. For example, in the immediate treatment of the baby, the nurse may be required to draw blood from the arm of the baby. This can be injurious if it is not done most effectively. This outcome has a short-term effect, and there is an expectation that the baby will recover quickly as the skin grows. The second outcome of a lab operation on the baby is the effect of radiation on the growth of the baby. This has a long-term effect on the life of the baby if the infant is subjected to radiology as a form of treatment for possible diabetes inherited from the mother. Such a method can expose the baby to unnecessary imaging that could end up endangering the life of the baby. Radiation and radiology procedures are more dangerous as they could end up destroying the tissues of the baby's body. The third outcome of a lab and radiology operation on the baby whose mother is diabetic is the total eradication of diabetic possibilities for the baby. The baby is subjected to numerous dietary, chemical, and thermal treatments to remove risks of diabetes on the body. The baby may have low calcium and low glucose levels. The nurse has to administer glucose and calcium components to the baby immediately after birth.